Encouraging news tonight in the fight against COVID-19. Scientists in the United Kingdom say an inexpensive and commonly available steroid can actually improve survival rates in severely ill hospitalized patients. The study, led by the University of Oxford, showed the drug dexamethasone reduced deaths by 35% in patients on ventilators and by 20% in those only needing supplemental oxygen. Joining me now on Skype to talk more about this and where things stand in the battle against COVID-19 in this country is Dr. Paul Carson, an infectious disease specialist and a member of the Catholic Medical Association. Dr. Carson, welcome back to the show. Good to see you.
Good to see you. Thanks for having me.
Absolutely. So these results are being studied cautiously, but this is being seen as very encouraging news.
That's right. This is a drug that we've had available to us for a long time. We use it in many, many different circumstances. And so this news coming from the United Kingdom with a very large ongoing study that they have there with such a dramatic mortality benefit was very, very welcome news. I do think we have to have a word of caution here because we haven't seen the actual published results. It was actually just put out in a news release. And so those of us in the clinical and research communities are really anxious to see the details of the research and the way that they conducted this. But so far, this looks very promising.
Yeah, and as you mentioned, this drug has been used for other purposes. Can you explain a little bit how it works for those with COVID-19, and are there any known negative side effects to it?
Sure. So dexamethasone is in a class of drugs called corticosteroids, or more commonly known as steroids. And these have a broad number of ways that they work to kind of tamp down our immune system. And one of the concerns with coronavirus and sometimes other severe infections is that the inflammatory response can be exaggerated and sometimes too far, so that it starts to cause damage to tissues like the lungs. And by trying to tamp that down a bit with things like steroids, we may be able to let the patient get through the infection, build up immunity without causing such significant damage to the tissues.
I know earlier this week the Food and Drug Administration withdrew its emergency use authorization for hydroxychloroquine and chloroquine, which were previously touted as treatments for COVID-19. Do you know where things stand right now in terms of other treatments for the disease?
Sure. So one of the other treatments that we are gaining greater and greater access to is a drug called remdesivir, made by a company called Gilead. That drug has antiviral properties that in early results from an ongoing trial suggested that people recovered more quickly, even with severe illness, when they got remdesivir compared to a control group. We're still waiting the final results of that trial, which should wrap up in the next, I think, few months, to see if it actually has more significant benefit, like a mortality benefit. But that also is a promising drug that has now been released in limited supplies to most states.
Quickly, I want to ask you, I know we're starting to see an increase in number of cases right now across the U.S. as restrictions are being lifted. What do you think needs to be done to help curb the spread of COVID-19 right now?
Right. So, I think we're all very anxious to try and get back to some semblance of life as we knew it before, with, a more sense of normality. But I think it's incumbent on us, even with a lot of our states opening up businesses and churches and more and more activities, that we should still take that individual responsibility to try and practice some degree of social distancing, good hand hygiene. One of the things that I see sometimes politicized is masking, and we should recognize that by my wearing a mask, what I'm saying is I realize that I might be asymptomatically carrying this virus, and I want to protect you by trying to block any of the large or medium-sized respiratory droplets that may emit that virus. So going indoors to like church, to the grocery store, to shopping, I think wearing a mask, again, doing good hand hygiene and keeping some semblance of distance until we get hopefully to a place where we have a vaccine is still very, very prudent.
Well, Dr. Carson, thank you so much for your time. Dr. Paul Carson, infectious disease specialist and a member of the Catholic Medical Association. Thanks so much for your time.
Pleasure to be with you. Thank you.